Welcome friends to this fourth video in the series of normal puerperium topic, and this is the last video of this series. You can get all the topics, all the videos in the playlist puerperium. Okay, now coming to what is the management of normal puerperium. We are talking about normal puerperium. In cases of high risk delivery, the same will be dealt with in the respective topics. What extra care you are supposed to give to a woman who is in puerperium after that condition. So in this topic, in this video, we will be talking about normal puerperial guidelines, what we have to follow in general in routine. So first of all, what are the principles that should be followed during puerperal care? To give the attention to the woman who is in her postpartum period, to prevent the infection, to take care of the child, to examine the child, and to motivate the woman to come back to normalcy, and also towards motivation for contraception. So these are the main principles that are to be taken care. So number one, what is the immediate attention that has to be taken? Immediately after delivery, we have told you that in early puerperium, that is 24 hours, she has to be monitored very carefully. And what about rest and ambulance? If she has given birth normally, she should be advised to move out of her bed and to go to pass her urine. So early ambulation is necessary. It should be encouraged. It has got its own benefit. It will avoid DVTs and it will help in subinvolution of the uterus as well. So early ambulation is a important thing that has to be encouraged in a woman who is in her puerperium. So what about the hospital stay? Routinely in hospitals, after 24 to 40, within 24 to 48 hours of delivery, uncomplicated cases, they are discharged. And if suppose it is a difficult delivery or suppose forceps or vacuum, then in that case you can keep her for 5 days, but early discharge is recommended. Now diet, she can take whatever she want to take. There are no restrictions. You have to tell her to take plenty of oral fluids also, and if she is lactating, then you have to tell her that she has to take iron and calcium supplementation apart from a balanced diet as well. Now care of the bladder. We have seen in the previous video that because of the delivery, there is a damage in the mucosa and nerve plexus as well of the urinary bladder, and it becomes insensitive towards the full bladder. So what will happen? There may be retention of urine and infection of that retention of urine. So what we are going to advise to a woman, that she should move out of her bed and go to pass urine. Also because of the perineal pain, because of the stitches that are there on the perineum, sometimes a woman fails to pass her urine. When are you going to catheterize? This is important. If she is not able to pass urine, and if you on ultrasound you get 60 ml of post void residual urine, if it is there, then it is better to catheterize the woman so that her normal tone of bladder wall muscle are regained. Now coming to care of the bowel, you ask her to take fiber in her diet, and if even if she is not able to pass stools, then you can add 20 gram of isabgol in her diet. Now sleep, she is already exhausted during labor and delivery. So in immediate puerperium also, you have to allow her to take rest, and as soon as she feels comfortable, she should be ambulatory. So care of the vulva and vagina, it should be taken care of. Seeds bath may help her relieve the pain, and you can use dusting powders that have antibiotics in them for dressing of the wound if it is present over there. And breastfeeding is allowed, has to be encouraged immediately after delivery, as soon as possible. So within a half an hour and as soon as possible. It is preferable to put the baby on the breast even before the cord is cut. This is also recommended. It has got a beneficial effect on baby and mother both. What on mother? You may be asked in your exam, when the child feeds on the breast, what hormones are being released? We all know, in the previous lecture we have seen oxytocin, and that oxytocin will help in the expulsion of placenta, and the chances of retained products are far less as compared. So it is better to put the baby immediately, even before cutting the cord. So how to avoid nipple soreness? You have to encourage frequent feeds, and you can also apply the hind milk on the breast. So that has to be explained to the mother. And nipple confusion should be avoided. What is nipple confusion? It is very frequently asked in your exam. And what are the causes? So nipple confusion, if you have given artificial nipple to the baby for feeding, that is, it is, baby does not have to work to get the milk out of it. So when the baby is put on mother's nipple, the baby will not suck very well. So in that case, there is nipple confusion. Again you will put it the artificial nipple feed, so that causes nipple confusion. Baby is confused to suck on mother's nipple, and this will lead to lactation failure and anxiety in mother also. So it is better to avoid such thing. This is a question that can be asked in either pediatric or in also your obstetrics. Also, what is important? Rooming in. This is also asked in your viva. What is rooming in? The babies, they are put either on the mother's cot, or the baby's cot is kept near that of mother. In the same room they are kept, and it improves the bonding of the infant and mother, and it helps in better outcome of infant and also of maternal lactation is established. A kangaroo technique is also there. It is generally asked in pediatric in cases of premature infant. They are babies are kept inside the clothing of the mother, that is kangaroo technique. So now antisepsis, asepsis, they are to be followed. You have to tell the patient about the need of all such. And what about immunization? It is asked. So 3 immunization can be done in puerperium. Number 1, if mother is if mother is RH negative and child is RH positive, in that case anti-D. Okay, number 1. Number 2, if mother is not previously immune against this rotavirus, sorry, rubella, not rota, rota is for infant, rubella virus, if she is not immune, then you can give her in the puerperium. And number 3, tetanus. If she has not got the second dose during her pregnancy, then before her discharge from the hospital, tetanus vaccine can be given. So these are asked in your exam. You should be aware about. The first thing you will be telling is anti-D. In case if someone asks you, tell us about what are the immunization protocol in puerperium. So don't get confused. There is no immunization in puerperium. First, this anti-D is also immunization. You have to tell anti-D, rubella and tetanus. So management of ailments. So there are after pains. They are more commonly seen in multiparous, and they can be relieved by simple analgesics. Now pain on the what are the causes of after pain? It may be asked in your viva. So what are the causes of after pain? Number 1, retained products of conception may lead to after pain, and also this after pain, they are more frequently felt during lactation. So what is the answer when an examiner asks you? Because of the milk letdown reflex, oxytocin is released from the posterior pituitary, and it will act on the uterus, and it contracts the uterus as well, and the woman feels pain in her pelvis. So that is the cause of pain that is felt during lactation, and it is more common in multipara as compared to priming. Now pain on the perineum, stitches, the seeds bath may help, and you have to give analgesics. And if you are giving analgesics to a woman because of the perineal pain, always don't forget to examine the site to rule out any hematoma that is taken place. And correction of anemia, iron and calcium, they are the supplements that are to be given in her neonatal puerperal period. And if she has any other condition, medical condition during her pregnancy, that has to be taken, that has to be dealt with in her puerperium, and a physician has to be involved. Now what are the postpartum exercises? Because of the delivery process, the laxity has taken place because of the maternal physiological changes that are occurring during pregnancy. The laxity has occurred in the various joints. So in her puerperium, she should be encouraged to do exercises. And what are the time period when she can go for exercises? It is if it is a normal delivery, and if she is comfortable and she wishes, then after 7 days she can resume exercises, increasing the intensity gradually, and duration and intensity. Now coming to what exercises immediately you will tell the woman to start. One is Kegel's exercise. It will help in the gaining tone in the perineal muscles. Then abdominal muscles के लिए what she will lie down with her thighs flexed, and she will take deep breaths and inhalation and exhalation. It will help in regaining tone of abdominal muscle. Then pelvic exercises, Kegel exercises for pelvic floor muscle. Then for back muscles, you have to tell her to lie down on her dorsal position and to lift her head and neck and shoulder portion. So these all will help in regaining her normal posture and muscle strength. So physical activity, she can gradually resume her physical activity over a period of 1 to 2 weeks, that is 7 days to 14 days. And if she is comfortable, she should be allowed to do her regular course after 6 weeks of her delivery. Now checkup, you will discharge her, you will give her a discharge advice, and you will ask her to come at 6 weeks for second checkup. And what advice on discharge you will give? It is an important question. You may be asked, you are discharging a woman in her puerperium, what are the advice that you are supposed to give to her? So first of all, you have to tell her to maintain her own health and to take adequate diet and continue supplementary iron and calcium therapy unless she is not told to discontinue. Then she should start her postnatal exercises that you have to tell her, so that to gain the muscle and overall well-being. Now for tell her about the need of immunization of the child. During that postnatal advice, you have to tell her that when she will have to report for immunization of the child. Also advice about intercourse in her puerperium. Preferably it is to be avoided for 6 weeks because of the changes in vagina that has taken place, we have discussed in the previous video. So this advice has to be there. And also you have to give her advice about contraception. Contraceptive have to be started in a non-lactating woman 3 weeks postpartum, and in a lactating woman 3 months postpartum. So contraceptive advice should be given, and advice about breastfeeding and its importance. So these are the advice that you have to give a woman when you are discharging her, and tell her to come back at 6 weeks postpartum along with the child. So it is preferable to have a baby wellness center attached to a puerperal clinic. So postnatal care we have almost covered. So routine examine, when she comes at 6 weeks, you will be checking her general condition. You will be if required pelvic examination, if required. If there are no symptoms, then there is no need to do any pelvic examination, and if required then lab investigation. So routine checkup is to be her height, her weight, her blood pressure, pallor, all these are to per abdominal examination, they are to be done. Then you will inquire about her bowel movements, about the breastfeeding, whether there are any problem or any ailments like backache or any other thing, and you have to give advice according to that only. So this was all about normal puerperium. If you have any doubt, please write down in the comment box. I will be happy to reply. If you like the video, please like the video and share among your friends and subscribe to our channel. Thank you.